Well, good afternoon, everybody. I'm going to hand straight over to the Director of Public Health, Dr. Henrietta Ewart, who will talk a little bit about where we are at the moment in respect of COVID on the island and the current case numbers. Henrietta.
Thank you, Chief Minister. I'm going to start just by taking us through the context of where we are with COVID, as Chief Minister has said, and how we've got there since the point in June when we opened the borders. So that's shown on this first slide. You can see the curve here of daily positive cases that have been confirmed by PCR, going back to the 28th of June and finishing on the 7th of November. Now, the slides that I'll be presenting today are all taken from the weekly epidemiological surveillance report, which is publicly available on the covid19.gov.im website, so you can find these and also find the deeper dives and the further analyses if you would like to. So what this curve shows is really what happened from the point at which we relaxed the borders, and in doing that we knew that cases would rise and that we would effectively equilibrate with the COVID position across the UK, and that's exactly what we saw happen. Bit of a slow burn as cases started coming on the island and the people infected started mixing and infecting other people. But then, as always, once it had got some momentum going, we got that really quite marked peak up to around 320, 330 cases a day. And then it's come down, and it was carrying on going down really until September, when the schools going back actually caused mixing of people who hadn't mixed over the summer holiday, and that's actually the perfect recipe to start driving a rise in cases, and that's absolutely what we saw, and now that's coming down again. And the points about this are, basically, COVID is a disease that passes between people, so you have to mix, and in order to get it you have to be susceptible to it. So the more people mix and the more susceptible people there are, the more cases there will be, and this will fall off basically as people are infected or because they have immunity in other ways. And the key issue for us in that, and one of the key things that was taken into consideration in deciding to open the border when we did, was that there was significant immunity from the vaccination rollout, which had already achieved good uptake by that point, and has obviously achieved better uptake since. Now, that's the overall curve, which is all age groups, and in terms of understanding exactly what's happening and what the risks are for us as we go into winter, we need to understand how that looks in different age groups. So this is looking from early September, the point where schools were going back, again until the 7th of November. And you can see that again at the beginning of that, younger people, the 10s to 19s, did have higher rates, but not massively higher rates, and all age groups were really there or thereabouts. Obviously the groups that have the highest coverage with vaccination were lower, and then the ones that were either waiting to come through the vaccination programme were kind of in the middle. At that point the 10s to 19s were not being vaccinated. So of course when they went back to school, that meant there was a population that had very little immunity, and not surprisingly COVID went right through it with that high peak there. It then levelled off and it's now coming right down, and that is a mix of the fact that we're now rolling out the vaccination in that age group, although the coverage is not yet up to what it will be. And of course the other thing is that eventually any infectious disease will have infected most of the susceptible people, and it will have run out of new people to infect. So in a way that's, well, I mean, not in a way, it actually has driven natural immunity. So what we're looking at now as we go into winter is really all age groups who will have some level of protection, either by natural immunity and or vaccination. And the thing that we need to be careful about there, and this will be picked up in Chief Minister's presentation on the winter plan, is waning immunity once you go 6 months beyond your double dose of vaccination. And that's why the booster programme is so important to getting us through the winter. That's just a slide which is showing the breakdown of the younger age groups, and again you can see it's the younger portion of the secondary school age group that has really driven this, and then there is some, the younger ones, the 5 to 9s, were behind the curve on that, and that's largely because that's sibling household mixing that has infected them. And then the older group, the 15 to 19s, had a little bit of a kick, but have stabilised. So that's really where we are at the moment. This is the effective reproduction number, the R number, which basically shows for every one person infected, how many more will they go on to infect. So it's a measure of whether the outbreak or the wave, or whatever you like to call it, is growing or whether it is actually diminishing. And you can see the R number, when things really got the momentum going after the borders were opened, was well over 20. It's come down, it's had that kick when we had the rise in the schools, and it's now coming back down again. And currently, for the last week, it's running at 0.46. So that means that if things carry on as they are, the wave has lost its momentum and it will be dwindling right down. Which could be very good timing in terms of winter pressures, because it means COVID, so long as we carry on like this, will not be too big an issue, but there are caveats about that which we'll hear about in the winter plan. And this is just to show really the equilibration between us and the UK. You can see we're now looking like some of the areas of Northern Ireland, and we've come down a little bit lower on the 7-day notification rate than the North West. So that is all to the good. We hope it will continue, and we'll hear about ways to try and ensure that from the Chief Minister now.
That's great. Thank you very much, Henrietta. So I just wanted to expand a little bit more about COVID in our winter framework. There is no undue cause for alarm, but I did want to make 3 key points to you all, and also to emphasise that we are still going to have to manage this pandemic throughout this winter and possibly beyond in a responsible manner. So the first point I wanted to make is that COVID hasn't gone away. Please do not get lulled into a false sense of security that COVID no longer poses a threat to us. It does, it's endemic, and it's likely to keep coming back. So please do not be complacent. Secondly, get vaccinated and get your booster jabs. The vaccines are working, but as Henrietta Ewart has quite eloquently explained, their effectiveness will gradually reduce, so it's vital that when the time comes that you get your booster. And thirdly, be responsible. And that really means being aware of what is happening, wear your mask as appropriate, particularly if you are in unfamiliar surroundings or using public transport or are aware of COVID cases in your area or close to family and friends. And crucially, use your lateral flow tests and use those tests on a regular basis, particularly if you are working or at school in busy environments. So we do have a winter framework, and we've put one in place. And I just want to explain why we've chosen to put this framework in place, partially for the reasons I've just explained in terms of complacency, but also we cannot ignore the difficulties and pressures that winter brings when it comes to respiratory viruses, and that now includes COVID-19. The Council of Ministers has requested that a framework be drawn up, setting out how the island can best approach COVID through the winter months, but also to give clarity to everybody as to how we are likely to act. So the framework sets out 3 clear objectives: to minimise the harm and disruption caused by COVID, support people in making informed choices, and mitigate against the uncontrolled transmission of the virus. And all of this really is essentially to protect our NHS capacity and capabilities, of course our community and our island. We want COVID cases to be as manageable, at a manageable level as possible, so that life can continue as normal. And this winter framework sets out 3 response levels. Level 1, which is our base response, things that we all need to be doing now. It's those basics that will help prevent the spread of the virus as we come to know. hands, face space and fresh air, along with vaccinations, testing and mask wearing are all the sort of key essentials here. And it is about taking personal and collective responsibility as an island community and sticking to the basics to minimise the risk of the virus spreading. As I've already said, get vaccinated, please, and get your boosters. The vaccinations remain our greatest defence against this virus, but the protection, as we've emphasised twice now, wanes over time. So please turn up to your booster appointments, and if there are genuine reasons why you can't make it, then please rearrange the appointment by calling 111. And secondly, then, we have a level 2 response. As we know, the virus is likely to spread more in winter, and we've seen a recent surge in cases, although that has come down significantly. But if the need arises, this is where level 2 fits in. Increased national mitigations, things we may need to do. So if the winter pressure increases the risk to our health and care provision, the public should expect to see us strengthening the advice that we give in a more robust way. What will this look like? Well, for individuals, it will mean an expectation that face coverings are worn where it is difficult to distance, where there is close mixing, or where ventilation is poor. We may ask people to test themselves more often, and we may have to revisit our testing strategy. We may also have to ask people to avoid unnecessary household mixing, and for businesses it may mean that we are asking people to work where possible from home. So level 2 is about asking the public to do everything possible to reduce transmission of the virus and lower case levels. We do have a third level available. Level 3 is about legal interventions, an approach we want to avoid returning to, where government must tell the public what to do. This, in our view, is a last resort, and whilst I hope that we do not need to return to putting in place legal measures to compel people's behaviour, this option must remain open to us. So there are 3 scenarios where we anticipate a move to legal restrictions and measures may be necessary. 1, if our health and care services are in danger of being overwhelmed because of COVID-19. Secondly, if there is a new variant of concern that the vaccine may not protect us against. Or thirdly, if there is significant disruption to island life, such as the number of people having to isolate is impacting on core services, education and or infrastructure. Our aim is to avoid this level of response, but as I set out at the beginning, if we are to avoid this, it needs all of us to take personal and collective responsibility and do our bit through the winter months to keep the virus under control. So this is a framework, a guide. Our response will need to shift and flex to meet circumstances. For that reason, there is no particular trigger for a move from one level to the next. I can tell you that a new national COVID response group has been formed for improved decision making, which includes representation from the chair of the Emergency Advisory Group. The group will monitor the position regularly with information on borders, education, data on case numbers and trajectory, and the status of our health and care system, economic indicators and community measures. There will also include and be monitoring of UK and international developments with recommendations that arise from any of this fed directly into the Council of Ministers for decision.